The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. The U.S. Centers for Disease Control says the risk of an outdoor COVID-19 infection could be as high as 10%, but reports are circulating that the actual number is much lower. In fact, evidence shows it could be less than 0.1%. In this episode of Medical Minutes, I speak with Dr. Cole Beeler, infectious disease specialist at IU Health. Beeler says the federal agency's estimation is grossly misleading, and he's just not buying it. Our conversation is next. Joining us now is Dr. Cole Beeler, infectious disease expert from IU Health. Always great to see him and have him on. Dr. Beeler, welcome.
Nice to see you.
So we have this, the CDC is saying the risk of being infected with COVID-19 outdoors is 10% or less. But okay, 10%, that's low, but there are now reports that are circulating that this could be an exaggerated number. I want to get your thoughts on that. What do you think?
Yeah, so my understanding of the literature that's out there, there's a meta-analysis that looked at this, and there's been meta-analyses of meta-analyses. There's a lot of attempts to try and bring disparate data sets together to say what the risk is. And I'd say it's all not great data that they're trying to lump together. So it's really hard to compare studies between two different groups. There's always the potential for bias because a lot of these studies are based on recall and based on interviewing with people who have been infected. What I would say is that 10% to me seems to be driven by a study that had very high incidence, I would consider relatively, of outdoor transmission. I think it's much, much lower than that, looking at the other studies that are part of the meta-analyses. And while 10% is potentially possible, I'd say the vast majority of the evidence argues against it, and actually is probably a lot lower than that.
Okay. So just to be clear, the CDC was basing their percentage, the 10% number, based on a certain study, while this other studies are based that it could be lower. I mean, I'm looked at this reports, and it could be as low as 0.1% are basing it on others. So can you speak just to, is that what I'm hearing correctly?
Yeah, right. So I think the CDC is saying, infection risk outdoors could be up to 10%, is my understanding, which is kind of painting worst case scenario, which I think the motivation behind this is to just say, hey, you be careful outdoors. And I think that 10%, even though you're right, it is a relatively smaller number, is actually like 1 out of 10 transmissions happening outside. That still seems a lot to me, and I don't really buy that. The more data that's coming out really suggests that the outdoor environment is not as risky as the indoor environment. So looking at all the studies, the vast majority of them, actually, the median's a lot lower than that 10%.
Wow. So why isn't this getting out into the public? I mean, I asked this question. I mean, I understand why being cautious. We just want to be cautious. That's, we want to be protected from this. This still isn't over. But why isn't this consensus coming to a number? Why? I mean, I asked this because I looked at a poll today, and it said that indicated that the number one vaccine hesitancy is because there's so many mixed messages out there, and this is just another thing that is contributing to that.
Yeah, I totally agree. And I think, we have to be realistic with the vaccine, is that it's not perfect, but it's extremely good, like way better than we could have ever hoped at the beginning of this pandemic at this time point. And there's always going to be risk, but the highest percent chance risk is in close quarters, indoors, for long durations of time, and outdoors just really isn't showing that risk. So to answer your question, I don't really know why this isn't percolating its way through to the public. I think there's still a lot of fear that's out there. There's the question of variants. There's uncertainty with if we're going to need a booster. And I think everyone's hesitant to take their foot off the preventative gas and start de-escalating some of these measures. But personally, my opinion is that we're getting to the point where we need to start considering these processes, especially in groups that are uniformly vaccinated. The best thing that we can do, I think, from a public health perspective, is send the message that the vaccine is effective and it does let you live in a situation that's more akin to 2019 than it was to 2020. We have to have surveillance, we have to watch, we have to test hypotheses because this could change over time. But right now, we're just not seeing data that the vaccine isn't protective.
Isn't protective. And, especially outdoors. We've spoken about this for over this past year, and things have changed, and you've spoken very articulately about outdoors specifically. And any last thoughts in terms of what we can do to, I know it's just, right, this is always changing. We don't know. We have to be cautious. And I think, as you mentioned, this might be out of precaution. You talked about the variants that are circulating. But yeah, it's just really interesting. Fully vaccinated people and up to a 10% chance of infection. And then this sort of, I don't know, my question is, I just want to, untangle this. I'm very confused. And as someone who's been reporting on this, this was kind of shocking to come out today.
Yeah. I think probably what we're witnessing right now, and a lot of the frustration that people who maybe aren't in science or not in infection prevention or infectious disease or medicine are experiencing, is that it feels like there's mixed messages that are coming out. And I think there's just still a lot of uncertainty and debate about how to take our foot off the gas, about how to start de-escalating these processes in a safe way that doesn't lead to another surge. Because certainly we have evidence in the past of, decreasing adherence measures, especially during the peak of the pandemic over the winter, led to local surges. So no one wants that to happen again. And I think everyone's just being ultra conservative with trying to only reduce or release one thing at a time to make sure that we don't see those. But that said, I think that, we want to send the message that the vaccine is effective and that it will protect you not only from getting infected, but also from infecting other people, so that we can actually encourage people to get the vaccine. And that comes with a carrot at the end of the stick, which is being able to start doing these things that you were able to do before the pandemic, going outside, being with loved ones, having cookouts. We're getting closer and closer to that. And I think we need to start pushing that message a little bit further.
Well, Dr. Beeler, I love how you phrase that, take the foot off the gas pedal in a sense. And, this is something that we want to have some sort of reward to be able to go back to the things that we love and miss without having that fear. And you put that number into perspective. At up to 10%, that's 1 in 10, right? But I don't know. Any last thoughts on this?
Yeah, again, I think that each of these studies, and I think people how people decide to present these studies is really up to the message that you want to send. And at the beginning of the pandemic, I very much agree, saying that we don't know a lot about the outdoors. Be careful outdoors as well. We're in a very different place right now with the vaccine being available and with the extra data that's been accumulated, that we can reapproach this and say, maybe this is not something that's as high as 10% driven by one study from Singapore. Maybe it's something that's a lot less than that, driven by the vast majority of the other studies, and use that to change policy and to change how an individual is going to approach to some of these interactions throughout the summer.
And that is so right. In terms of, wanting to, it's unfortunate it happens in not just, maybe in this case, but in, academics in general. It's like, what message do you want to put out there? You can always spin the data. You can always spin the message. Scholars are wonderful. That's why we have all of this knowledge. But sometimes, I don't know. I don't want to make a sweeping statement, but that's a great point that you bring up. I think that's important for people to know, just to know in the back of their mind that, there's always two sides. So if that's what I'm hearing, I don't want to put words in your mouth by any means.
No.
Support
Again,
the academic community completely. Yeah.
Yeah, you're going to get me in trouble.
No.
I think, I think you're exactly right, is that, you really have to look at the study itself and look at what it's saying, but then also look at comparator studies and kind of see what makes up the comments that are being made as summary statements. Because when you actually look deeper into this case, you actually see that the way that the data is collected, the bias that's intrinsic in it, actually paints a much different picture than you have a 1 in 10 chance of getting this outdoors if you're around someone with COVID. To me, it's a lot less than that, looking at the vast majority of the other studies. And I think that's what we're seeing epidemiologically as well, is that the outdoors is a safer place to be. And we should try and push people to be doing things outdoors after or in preference to the indoor setting to help protect them.
Right. I mean, why wouldn't we? I mean, perfect time. It's summer and people want to get outside anyway. So, yeah, let's get out there. Oh my gosh, Dr. Beeler, I mean, just really, you're so insightful. I always enjoy talking to you. Really, I mean it. Thank you so much. This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
Learn more and get more with Wish TV. Online at wishtv.com and when you follow Wish TV on Facebook. Be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.